Hi, my name is Angela, and I'm a nursing student at the University of Michigan. This semester, I was placed at the Care and Rehab Center at Glacier Hills Nursing Home. Today, I'm going to be presenting a patient to you. This patient is an 84-year-old Caucasian male who is married. He is currently retired, but his former occupation was the parts manager at the University of Michigan Parts Garage. Patient was admitted to Glacier Hills Nursing Home following his triple bypass surgery on March 3rd. And the week prior, on February 27th, patient experienced a massive heart attack, thus the reason for his surgery. He is currently undergoing rehab to regain strength and be able to return home. Patient denies any chest pain since undergoing surgery. Vitals were not taken on this patient due to busyness with activities with his family, but according to his chart, they are relatively stable. Past medical history: hypertension. All immunizations are up to date. Patient last received the influenza vaccine on November 1st, 2014. No known drug or medication allergies. Patient is currently on numerous medications for chest pain. He is also taking 1 tablet of terazosin daily for hypertension, as well as the blood thinner warfarin. Past surgical history. Patient has previously undergone shoulder repair surgery and more recently coronary triple bypass surgery. Functional assessment. Patient denies any use of alcohol, tobacco, or illicit drugs. Patient reports exercising 4 times per week prior to his heart attack, a level he is currently trying to return to. Patient reports getting on average 6 to 7 hours of sleep per night, and he denies any sleep disorders. Patient states he eats a balanced diet and rates his overall food intake as healthy. He limits his caffeine intake to 1 soda per week. Psychosocial. Patient says he has a great support system. He currently lives with his wife, who he has been married to since his 20s. He has 4 children as well as multiple grandchildren. Patient reports no perceived stressors. He denies any interaction with environmental hazards or chemicals, but states he could have possibly been exposed to chemicals while serving in the military. Patient's level of education is a high school diploma. His patterns of health care include yearly physicals. Family history. Patient's father passed away from lung cancer. His mother was diagnosed with Alzheimer's disease. Patient denies any other family history of diseases. Review of systems. Cardiovascular. Given the patient's recent heart attack and cardiac surgery, it is important for us to assess his cardiovascular system. Patient denies any chest pain since undergoing surgery 2 weeks ago. He also denies any numbness of the arm or jaw. Patient has had hypertension for about 10 years, but denies any history of heart disease or heart murmurs. He states he has noticed an increase in fatigue since experiencing his heart attack and surgery. He can currently walk about 1 lap at the gym or 1/10 of a mile before becoming distressed. Patient experiences tenderness of the chest while lying flat and reports no palpitations. Upon examination, contour of the chest appears normal. There are no signs of pigeon or funnel chest present. A scar is present upon the left side of the anterior chest. No heaves or thrills over the 5 key points of the chest were detected upon inspection. Palpitation was not performed on the patient due to the tenderness of his chest, especially over the scar from his surgery. Upon auscultation, all the heart sounds appeared normal. There were no extra abnormal sounds noted, including S3 and S4 sounds. There were also no heart murmurs present. Auscultation was done with the patient in both sitting and supine positions. Review of systems. Peripheral vascular. Again, it is important to perform a peripheral vascular assessment on this patient due to his recent heart attack and the intertwinement of the cardiovascular and peripheral vascular systems. Patient reports some pain in lower extremities while walking and states he has a compression neuropathy present in his lower extremities. He reports edema and coolness on the lower extremities and denies any hair loss. Patient denies any history of blood clots in his legs and denies any history of varicose veins. Upon examination, color of lower extremities is consistent with that of the rest of the body. No varicosities or hair loss are present. Temperature of the lower extremities appears slightly cooler than normal. Patient denies any feelings of tenderness during palpitation. Skin on his lower extremities appears and feels dry, with some flaking present. Edema is present at a 2+ on the edema rating scale, as the pitting lasted for about 10 seconds. No ulcers were present, and cap refill appeared slightly longer than 3 seconds. Upon palpitation, temporal pulse was present at a 2+. Carotid pulse was present bilaterally at a 3+. Brachial pulse was noted as a 1+ bilaterally, and radial pulse was rated as a 2+ bilaterally. The femoral pulse was not assessed on this patient. Popliteal, posterior tibial, and dorsalis pedis pulses were all unable to be detected, so they were rated as a 0 on the pulse rating scale. This is most likely due to edema. Pertinent system number 1, respiratory. According to the article, Risk Factors for Postoperative Mortality and Morbidity in Patients Undergoing Coronary Artery Bypass Grafting, published in the U.S. National Library of Medicine, a common unwanted complication of triple bypass surgery can affect the respiratory system. The combination of the anesthesia and the surgical procedure puts stress on the lungs, especially the pulmonary endothelial beds post-operation. This can result in decreased vital capacity, decreased functional residual capacity, and reduced lung compliance. Therefore, it is important we assess the respiratory system of our patient due to his recent undergoing of triple bypass surgery. Pertinent system number 2, neurological. According to the article, Central Nervous System Complications of Cardiac Surgery, found in the British Journal of Anesthesia, it is important to assess the neurological system in our patient due to his recent undergoing of triple bypass. Neurological complications to the CNS, including but not limited to deterioration of intellectual functioning, confusion, agitation, disorientation, or memory loss, may occur following cardiac surgery. These symptoms may not present themselves immediately after surgery, but rather in the weeks following, so it would be important for us to assess our patient's mental status using a neurological exam. Thank you.